Hello, I'm Ian Koskinen, presenting with Negron-Fernandez from Northern Michigan University. Ischemic Preconditioning improves time until failure during rock climbing specific tasks. Rock climbing is a popular endurance sport that utilizes isometric muscle contractions in order to maintain grip, particularly in the forearms, to climb to great heights. Climbers may experience fatigue as pain in the forearms, which can lead to an inability to maintain their grip, which could result in a fall and injury. Ischemic preconditioning, IPC, which is the process of repeatedly occluding and reperfusing blood flow to an extremity via inflatable cuff, has been shown to improve time until failure. Performance increases are likely due to the reperfusion after the ischemia, increasing the oxygen availability in the muscle, delaying the onset of fatigue. Ischemic preconditioning has been shown to be effective in endurance sports like swimming, cycling, and running, but not in rock climbing. The purpose of this study is to determine the effect of IPC on time until failure on a rock climbing specific task. Our hypothesis is that there will be an increased time until failure following IPC. This study of 9 participants used a randomized crossover control design in which eligible and consented individuals completed 2 separate rock climbing specific isometric contraction protocols. Tests were completed at least 24 hours apart. After receiving their informed consent, participants were randomly assigned to either the experimental or control test. After being set up in the apparatus and a maximum value established, they will then either proceed through the IPC protocol or wait for the experiment to begin.
Initially, the subjects are tested on their maximum voluntary isometric contraction, MVIC, by isolating the forearm muscles. 3 tests of MVIC were performed and 40% of the peak was calculated as the target intensity. This was followed by the IPC protocol, consisting of 3 cycles of 5 minutes of occlusion, followed by 5 minutes of reperfusion. For occlusion, the blood pressure cuff was positioned over the upper arm and the pressure was set to 200 millimeters of mercury. For the rock climbing specific assessment, the participants were asked to repeatedly hold 40% of their MVIC for 8 seconds, resting for 2 seconds, until they were no longer able to reach the target intensity. Force tracings were streamed onto a monitor so that the participants had visual feedback of the force they produced, which enabled them to more accurately reach the target intensity. Our outcome measures for this study were time until failure and EMG slope. The EMG slope is the change in average EMG activity over the course of the fatiguing protocol. We used a paired samples t-test to analyze our data for this study. As seen on the graph to the left, time until failure was significantly longer following IPC than in the control condition, with a mean of 207 plus or minus 74 seconds versus 185 plus or minus 80 seconds respectively, with a p-value of less than 0.05. On the graph to the right, the EMG slope, however, did not show any significance in the study, with a p-value greater than 0.05. The purpose of our study was to determine the effect of IPC on a time until failure on a rock climbing specific task. Our main findings were that IPC was shown to increase time until failure in rock climbers. Rock climbers may be able to perform IPC before climbing to improve performance and decrease the chances of a fall. While the data shown so far shows some significance to the hypothesis, we are still in the process of collecting more data. In the future, we would like to test on an experienced rock climbing population who have increased aerobic capacity in the forearms, which may decrease the effectiveness of IPC. It would also be beneficial for IPC to be applied and tested to an environment that mimic the sport or repeat the study on a rock climbing wall, because in a less controlled environment, other factors other than forearm oxygenation may override the effect of IPC.